Hello everyone, how are you doing? And this is Dr. Sam, and today we're gonna review over a few questions from anatomy. Our first question is: 44-year-old man comes to office for evaluation of a neck lump. He's noticed his length 6 months ago and was shaving while he was shaving, and says it was growing in size from that time. Physical examination was done, and nodal mass is found in the left thyroid lobe. There was no pain, shortness of breath, cough, etc., whatever. My way to solve this kind of question is to just start reading from the last one or two sentences and then go above. So the last sentence is: which of the following nerves most likely injured? The sentence above is: while attempting to ligate the inferior thyroid artery, the surgeon accidentally damages a structure that lies close proximity to it. So that means that total thyroidectomy is done, and the inferior thyroid artery has been ligated, but a structure that is close to the inferior thyroid artery, which is a nerve, is been asked which is most likely injured. So the question is right that we don't even need to read whatsoever given above. So it's a straight questions kind of application to the anatomy. So a structure lying close to the inferior thyroid artery. So what's your answer, sir? So I think it's D, recurrent laryngeal nerve, because kind of this inferior thyroid artery is very close to recurrent laryngeal nerve. We know that from the anatomy. Let's see the explanation. So the answer is D, the recurrent laryngeal nerve. So over here we can see this is the arch of aorta, this is left brachiocephalic, this is left common carotid, and from the left brachiocephalic we have thyrocervical trunk, whose one of the branches inferior thyroid artery, which goes and supplies the inferior portion of the thyroid, and close to is the left recurrent laryngeal nerve. On the other side too we can see the same. So the answer would be left recurrent laryngeal nerve. So moving on to the next question. Okay, a 6-year boy is brought to the emergency department by his parents due to the persistent nasal bleeding. So it is a case of nasal bleeding. Now let's read the last line. Cautery was most likely applied to which of the following location in patient's nasal cavity? So cautery is done in the patient nasal cavity to stop a persistent nasal bleeding. So nasal bleeding, the most common site is the Kiesel black plexus. We all know that. So Kiesel black plexus lies on the nasal septum. So my answer, the options are, you can see that inferior turbinate, middle meatus, nasal septum, posterior choana, and posterior lateral wall. My answer would be nasal septum, because Kiesel black plexus lies on the nasal septum. So let's see. So it's C, nasal septum, and here we can see the Kiesel black plexus. Let's have a quick revision because it's a review. So this is the Kiesel black plexus. This plexus is formed by basically from 4 branches coming from different arteries. So we have anterior ethmoidal artery, we have a sphenopalatine artery, we have this greater palatine artery, whose branch is there, and superior labial artery, which is the branch of facial artery, whose branch is there. So 4 branches forming Kiesel blood plexus on the nasal septum. So the nasal septum cautery would be done on the nasal septum. So our next question is: a 36-year-old man is rushed to the emergency department after a sudden shortness of breath and difficulty swallowing. He has visited the emergency department several times for the food and skin allergy. So this is a kind of case of anaphylaxis, and we have laryngeal edema. So that's why he is feeling like shortness of breath, difficulty swallowing. Let's read the last lines. The incision is made during the procedure most likely passed through which of the following structure? Let's read a line above. A decision is made to perform an emergency cricothyrectomy. So cricothyrectomy is basically is a incision done or an opening made in the cricothyroid muscle, which is between the cricoid cartilage and the thyroid cartilage. So it is a kind of a passage that is made to the trachea, and the tracheostomy is basically done here to secure the air passage. So we are asked like what are the structures that we have to pass to finally reach that cricothyroid muscle, and cricothyroid membrane and bridge to it, and then to from the trachea, and we can secure the airway. So what are the structures that are most likely we have to pass through? So buccopharyngeal fascia and platysma. Buccopharyngeal fascia is basically starts from the carotid sheath, which is a part of the deep cervical fascia enclosing carotid structures. So it's kind of it's basically we have two carotid sheaths on both sides of the neck, and that goes behind the neck, buccopharyngeal fascia. So that would certainly not be the answer. The second, platysma, is basically in front of the neck and is a part of superficial fascia, but buccopharyngeal fascia is not the part kind of structure that is anterior, lies in the anterior part. So first option is not the answer. Second is the platysma and thyroid isthmus. Thyroid isthmus is the part of the thyroid that connects the two lobes of the thyroid. So passing through the thyroid isthmus is like damaging the thyroid. So, and platysma is superficial structure of the superficial fascia that I told you. I think certainly B would also be not be the answer. So pretracheal fascia and cricoid cartilage. Pretracheal fascia and cricoid cartilage. So we are going to break the cartilage. So I don't think that would also be an answer. Let's move on. Pretracheal fascia and prevertebral fascia. So prevertebral fascia, as the name suggests, is in front of the vertebra. It's in the front of the vertebra, so certainly it would not be in front of the trachea. So D answer, option will not be there. And superior cervical fascia and cricothyroid membrane, and that could be the certain answer, because we have in the neck we have layers of fascia that covers the neck. First is first we have the skin, and then we have superficial fascia, and then we have deep fascia, and then we got the internal structures of the neck. So we have to first break the superficial cervical fascia, of which this platysma is a part, and then we go to the deep fascia. In the deep fascia, we will remove the we will have to go to the investing layer. We will have to go to the pretracheal fascia also, and then we will reach the cricothyroid membrane. We breach through that, and then we breach the trachea and secure the airway. That's how it will work. So answer would be E in my way. So you can stop the video and you can try to answer it by yourself, but I think that's the explanation. E is the answer. Let's see. There's the answer. So here that's the palpation method is been shown. Like we have the Adam's apple, that is the prominence, and below that, two finger below that, there is a cricothyroid membrane. There's where we have to breach through it. So there is an incision in the cricothyroid membrane, and we will enter into the neck and trachea. For more contents like this, don't forget to like, subscribe, share and comment.